Welcome to Adult Education Wolverhampton. We're going to do a first aid session and we're going to look at CPR and the safe use of the defibrillator. So first of all, we need to follow the procedure Dr. ABC. So we need to check for danger, make sure the area is safe for us to approach, make sure there's no hazards. Hazards could be to us, electrical cables, children, family members or members of the public. Okay, so now we need to check for the R, which is response. We'll tap our casualty on the shoulders and speak to him at the same time. Hello, can you hear me? The reason we do this is in case our casualty is deaf, and we're hoping that we will get a response from him by touching him and talking to him at the same time. However, we've got no response from our casualty, so now I need to open the airway. We do this by putting our hand on the forehead and 2 fingers underneath the chin, and we tilt the head backwards. Okay. And then what we're doing is looking and listening for 10 seconds to see if we can see the chest rising up and down, and to see if we can hear breath in our ear or feel breath on our face. We're doing that for 10 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Not breathing. We call for help, we dial 999. And then immediately we go to the middle of the nipples, right in the middle of the chest, with our heel of our hand, and we're pressing down 3 to 4 inches, which is 5 to 6 centimetres, and we're doing 30 compressions. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9, 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17 and 18 and 19 and 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. We'll give our casualty 2 breaths. When we're giving our casualty 2 breaths, we will need to use a face shield to help protect our casualty from us and us from them. Place the face shield over their mouth. Tilt their head back again and pinch their nose. Put your mouth over the mouth shield and blow twice. 1, 2, and then commence your 30 compressions again. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. You would continue this procedure until the ambulance people arrive. Okay? Now I'm going to show you how to use the defib. Okay? So once again, we're going to start from the beginning, and when I call for the help this time, I will call for my assistant to bring in the defib. Okay? So I've checked for danger. I'm checking for response. Hello, can you hear me? I'm opening the airway, looking and listening for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Not breathing. Hello, can you get me? Call for the ambulance, and can you bring me the defib, please? And then I will continue with my chest compressions. 1, 2, 3, 4, 5, 6, 7, 8, 10, 11, 15, 16, 17, 18, 19, 20, 23, 24, 25, 26, 27, 28.
Tear open package
30.
And remove pad.
Okay, so I would continue the process of giving breaths and 30 compressions while my colleague then sticks the pads and works around me.
Remove pad. Peel 1 pad from plastic liner.
So imagine I've given my casualty 2 breaths, and then I will continue with my 30 compressions.
Peel 1 pad from plastic liner.
I will continue to do this while my colleague applies the pads to the casualty.
Upper chest. Place one pad on bare upper chest. Peel second pad and place on bare lower chest as shown. Peel second pad and place on bare lower chest as shown. Do not touch patient.
The machine's told us
Analysing
not to
rhythm.
touch now. It's checking for a heartbeat.
Do not touch patient.
They need to make
Analysing
sure that
rhythm.
you're not touching.
Shock advised.
It's telling us to shock.
Charging.
It can't find a heartbeat.
Stand clear.
Make sure your
Shock will be
colleagues and
delivered
yourself is
in
not touching the casualty.
3, 2, 1. Shock delivered.
Okay?
It is now safe to touch the patient.
Okay, so the shock's been
Start
delivered.
CPR.
Now I can continue with
Give
CPR.
30 compressions. Then give 2 breaths. Give breath.
And then I will give my casualty 2 breaths, if I'm giving breaths, and then continue with my 30 compressions. We will continue this process until the machine tells us to do something different, or until the ambulance people arrive and take over from us. So we would continue the process and listen to what the machine tells us to do. After every 2 minutes, the machine will recharge itself and it will analyse the heart rhythm. So when analysing the heart rhythm, it's checking for a heartbeat in your casualty. If it detects a heartbeat, it will tell you not to press the shock button, but to continue with CPR if needed. Okay, you will continue this process until obviously the ambulance people arrive. It is important for you to remember how many times you press the shock button, because the ambulance people will need to know that. Okay, the machine will not shock the casualty automatically. You need to press the shock button to deliver the shock. Thank you. Okay, so when dealing with a casualty who's potentially not breathing, we're unfamiliar with our casualty and they may have COVID, what we need to do is make sure that we protect ourselves and also our casualty. So we need to get a cloth, it could be a tea towel or anything like that. We need to put it over their mouth and nose, like so. Okay? So, we still need to be checking for danger. And then we need to check for response. But this time I don't want to get so close to my casualty, so I might be tapping them on the bottom of their foot to see if I get a response from them. Okay? There's no response from my casualty, so now I need to check if they're breathing. So I'll do this from a distance and I'll be looking at their chest and I'll be seeing if it's rising, and I'll still be doing that for the 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It appears that my casualty is not breathing, so I do need to come down, make sure that I've got my mask on and keeping myself safe. I need to open my casualty's airway, and then I would continue with my 30 compressions. The reason why we put the towel over the casualty's face is so that when we are pressing on their chest, that there's perspiration isn't coming out of their mouth and nose and possibly infecting us if they have COVID. Thank you.